eating salt less reduces a risk factor for heart disease. If we can get into the habit of eating salt less, even if we only cut just 1 gram of salt from our diets, such as a slice of bread, a single salty potato chip, or a glass of wine, the rest of the year can be the same. Even if we restrict ourselves to 1 gram per day, in some years that could reduce our risk for heart disease by 30%. It takes 2 things to make your heart beat, that is, the exertion of energy, exercise, and the oxidation of fuel, your food choices. Oxidation is the chemical reaction that makes fuel burned. It is what makes gasoline burn and what turns light water into steam. Just as gasoline makes up part of your engine, nutrients are necessary for the heart to keep beating. Your body is like the engine of your car. If the fuel provided by the food you eat is perfect, your body will be like the piece of machinery that you have in your car. If you give it dirty or bad fuel, or you do not eat enough, your body will eventually meet its fuel limitations. For example, as your body ages, cholesterol levels will begin to increase. If your diet is high in fats, or you do not eat enough vegetables, then your body will have problems oxidizing cholesterol to the point that it is dangerous. In other words, your heart will have problems. Instead of having a heart attack, you will have a heart attack. Your diet also affects your blood pressure. When your blood pressure is high, your heart has to pump harder to pump the blood around your body. If a person has high blood pressure, and they gulp down salt-free or low, they will have a very hard time pushing the blood around because the blood is too thick. They will eventually wind up constipated. The body will do what it needs to do in order to survive, and the only way it can do that is by taking from the available fuel. In other words, it will rob you of nutrients until the problem gets so bad that you are forced to lay down on the seat below you. That is why you should always eat foods in their natural state. Taking a supplement or changing your diet is the best, but natural is only one aspect of a healthy diet. The remaining 3 aspects are proper exercise, good sleep, and you should be watching what you eat in addition to that. 3 dimensions visual coordinates the size of an object as in dimension by seeing just how small it is. Originate with eyes focusing on a specific area of the visual screen. With that in mind, identify the major food groups that you should eat most often. Bread, cereals, and pasta up to 3/4 cups a day is a good amount. That amount can be difficult to do for some people, especially those who are time crunched for time, so do not make a resolution to eat less bread or cereals. Instead, eat cereals that are high in fiber and low in sugar. Add a piece of fruit to your cereal every morning. Eat chicken and fish once a week, maybe twice. Reduce the amount of red meat you eat in your diet, or don't eat it every day. Reduce your dairy and eggs, or eat just 1 or 2 slices of non-creamed cheese instead. Switch to skim milk occasionally, and buy the products with no artificial flavors or stabilizers, just like your mother might have done in the kitchen back when you were still suckling. Fruits and vegetables. You will need to eat at least 5 servings of fruits and vegetables every day, and sometimes omitting a fruit or vegetable in a fruit or vegetable combination can be a better option. Eat brightly colored fruits and vegetables with dark green or red-purple ingredients. Eat more when you do not feel like eating, for example, when watching TV or when you are stewing. Eat just 1 serving of vegetables with starch such as pasta or rice. Reduce your consumption of pasta and rice. Beverages. Drink water, teas, and low-fat milk. Supersize or extra-large sodas, and at least 1/12 ounces can of regular or diet soda a day are not part of a healthy diet, and are not part of the 5 to 8 serving of fruits and vegetables. If you drink coffee, limit it to 2 or 3 cups a day. Minimize your intake of alcohol. Meals. Plan meals for the week. Make your meal combinations simple and versatile. Avoid prepackaged foods and those prepared by restaurants. Learn what makes a healthy meal and what does not. Do not go more than 4 or 5 hours between meals without eating something. Stop eating when you are stuffed, have no appetite, or have an upset stomach.